Well, after diagnosis is confirmed, the treatment option will depend on the symptoms, but also depend on the individual patient. So some patients who have very minor symptoms from the hernia may wish to do nothing about it, and that will be entirely appropriate. If the hernia is causing more symptoms, then we could consider surgery. And that surgery could be either performed keyhole or open surgery. For instance, inguinal hernias, the treatment options would be either keyhole or open surgery, depending on the size of the hernia and depending on the patient. The most reliable operation is probably an open operation with mesh. That will be performed under general anaesthetic and would be done as a day case. So it means that the patient will come into the hospital on the same day and be discharged on the same day. The operation will take about 45 minutes to complete. We do use mesh to repair inguinal hernias, and the reason we use that is that before mesh was introduced, the recurrence rate was about 30 to 50%, really quite high. With mesh, the recurrence rate is down to about 2%. So it's been a complete game changer for that operation. So in terms of coming into the hospital, you'd be discharged on the same day. The staff here and the team at the SMEnquiries Hospital worked really, really hard in developing their day case surgery, which I have to say is really slick. The patient feedback from that has been excellent. So you'd go home after the operation. It would take probably a month to get back to normal. But in that time, it would be the first week, it would be a bit sore, a bit stiff. After that, it would get a lot better quickly. We would say probably no driving for a week and no heavy lifting for about a month. But in that time, if you wanted to do a walk or go a bicycle ride or do some exercise, after a couple of weeks, that would be fine.